A white paper incident tied to a local election, a measles outbreak happening at the exact same time. That was 1 week in the life of my guest on this episode. We talk about why relationships matter as much as any written plan, how funding instability is quietly reshaping public health emergency response, and what it really takes to keep a community ready for its worst day. You're listening to the PHEC podcast, episode 469. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley. I'm your host of the Public Health Epidemiology Conversations, a weekly podcast published every Tuesday since 2017. I'm an epidemiologist, public health consultant, entrepreneur, and author who has spent over 2 decades working at the intersection of health, community, and meaningful change. My book, The Public Health Consultant, Expertise, Entrepreneurship, Greater Impact, publishes December 2026 with Johns Hopkins University Press. Outside of this podcast, my consulting firm, Dr. C.H. Huntley, LLC, works alongside large nonprofit government agencies and tribal nations on strategic planning and implementation. One area where we have been doing a lot of work lately is workforce development, supporting organizations as they build and strengthen the teams and systems behind their community health work. This podcast is where I bring that same passion into conversations with professionals from across the public health landscape. I'm real excited to introduce you to my guest on this episode. My guest leads public health emergency response and preparedness for a county just north of Seattle, planning for the emergencies no one hopes to face. In this conversation, we talk about what it looks like to manage 2 crises at once, why relationships often matter more than plans on paper, and how funding instability is quietly reshaping this work behind the scenes. We also get into the advocacy this role now requires and why waiting to feel ready can hold you back. It's a conversation that opens up the field most people never realize exists. Now, before we wrap up today, I'll share how you can hear one more question that I asked our guest after we finish recording this episode, and that bonus is waiting for you inside of our PHEC podcast community. Let me formally introduce her to you, and then I'll connect our conversation. Gabby Hadly is the Public Health Emergency Preparedness and Response Program Manager for Snohomish County Health Department in Washington, where she serves on the department's executive leadership team and leads county-wide efforts to prepare for and respond to emergencies affecting nearly 860,000 residents. Her approach is rooted in a simple conviction that the relationships you build before a crisis are what determine how well you perform during one. Gabby's path to public health began with personal loss, a pivot from medicine, and a mentor who introduced her to epidemiology, a discovery that redirected her career. She earned her Master of Public Health from the University of British Columbia and has since walked across state and local public health systems, from running COVID-19 response operations in Texas to directing emergency preparedness programs and shaping public health policy in Washington state. Along the way, she has led statewide initiatives to strengthen intergovernmental coordination, helped secure millions in recurring funding to stabilize public health infrastructure, and built cross-sector partnerships that improve how health systems perform in crises in between them. She is passionate about building public health systems that are not only ready for the next disaster, but structurally sound enough to perform between them. And through it all, epidemiology has been the through line, shaping not just how she responds to crisis, but how she thinks about building organizations and systems that last. Let's connect my conversation with Gabby right now. Well, Gabby, welcome to the podcast. How are you?
I'm doing well. Thank you so much for having me, Dr. Huntley.
Yeah, I'm really looking forward to our conversation. I feel like we were having so much fun before I hit record, just laughing and talking and getting to know each other, connecting on so many things in common. This is like the best job that I get to talk to so many amazing people. So I am looking forward to our conversation. Why don't you kick us off by just introducing yourself? Tell everyone a little bit about who you are and what you do.
Yeah, absolutely. So my name is Gabby Hadly, and I lead a public health emergency preparedness and response program in Washington State. And I think the easiest way to probably describe who I am and how I got here is to go back to the beginning, if that's okay.
Yes, yeah.
So it all started on Father's Day when I was 11 years old. My dad actually passed away of a heart attack. And it was in that moment that I really started thinking about the impact that I wanted to have on the world around me. My dad was this amazing person that had a beautiful life. And I feel like got to do so many amazing things through his career. And so I really started thinking about at a really young age about what was that going to look like for me. And I think because we lost him so suddenly, I really felt drawn to trying to prevent other people from going through what I went through and what my family went through. So I set my sights on becoming a cardiothoracic surgeon. Very normal. I think that's what we all do after a loss is,
Mhm.
find ways to prevent that hurt from happening in the world. Because I really wanted to be there for other families on, the worst days of their lives. So I got my undergrad in biology, and then I went on to become a clinical scribe. So I was essentially documenting patient visits, getting all my clinical hours to go to med school. And I think it was about 8 months into my year-long placement at a clinic in Denver. We saw this one patient, and he was the exact same age as my dad. He had this really high cardiac risk, and he had two daughters that were about the same age as my sister and I were when we lost my dad. And the physician who I was scribing for essentially prescribed a medication and then lifestyle change to hopefully prevent a negative health outcome or a cardiac event in the next couple of years. And the patient was not interested in any of those interventions. So I remember sitting in this patient in this exam room after the patient left, and I was just kind of running through in my mind, like, how can we prevent people from ending up in emergency rooms or even clinicians' offices and getting this news in the first place? And I think as we all know, that's the question that public health really asks is how can we go upstream of, a negative health outcome or a health event? So from there, my mentor at the time actually recommended that I check out public health. And candidly, I had never heard of public health before. I had no idea what that was. And so I actually picked up a book, one of the first books I could find on what public health was. And it was called CDC Virus Hunters, like level 4 virus hunters. Really nerdy title. And I was like, yes, I'm going to read this book. And it's essentially a book about, some of the best epidemiologists in the world traveling around the globe and hunting down the most dangerous pathogens and figuring out, what's at the root of, disease outbreaks and then trying to prevent those outbreaks from getting bigger and, spreading to different communities. And I was like, yes, that's what I want to become. I want to do that. And so I went and I did my master's in Canada at the University of British Columbia with a specialization in epidemiology. And I actually graduated right into the COVID pandemic. And so went out to Texas and was leading the response there for, communicable disease outbreaks and congregate care settings across like 59 counties. And I think working a pandemic response can be a little exhausting at times. And so I knew I loved that crisis piece, but I really wanted to be able to zoom out and work on different types of emergencies. And so that's when I was introduced to public health emergency preparedness and response and found my way to Washington. And I've been in that space since. And so that's kind of how I got to where I'm at right now.
What an incredible story. Thank you for sharing that. So you weren't raised in Seattle. You just moved there for this.
Yeah, I'm originally from Dallas, Texas, and I've lived several places since. But I studied abroad in Australia. I lived while I was scribing in Denver, and then I got to live for 2 years in Vancouver, Canada, while I was doing my master's. And so I think that experience really introduced me to the Pacific Northwest and the people, and so I think that's when I really fell in love with the culture out here.
Oh, yeah. Yeah. It's beautiful out there. That's fascinating. So I am curious to know, and also, I my condolences, for your loss. Thank you for sharing that. That takes a bit of courage to even speak about that. And I always admire folks that can take that personal loss and somehow turn that into something that they can advance for good in a way. My condolences, and also thank you for sharing that. So. Is there a population or particular, say, public health interest or problem that you're really passionate about right now?
Yes. I think right now, the biggest thing, and this might be a surprising answer, I don't know, but the biggest thing that I'm really focused on is where does public health go from here? I think it's not lost on anyone that, local, state, federal, tribal public health, territorial public health has all gone through a lot of turmoil and a lot of change, both coming out of the pandemic and then through a lot of the changes we've seen through, multiple administrations now. I think one of the questions that I keep coming back to, especially in a lot of the spaces and boards and committees I sit on, is public health, we really see these ebbs and flows where there's great support and then there's a great disinvestment. And so where I'm spending a lot of my time thinking is, where do we go next? What does, public health look like in 10, 15, 20 years? And right now, when we're having to disinvest from a lot of the critical services and programs that public health offers at, the different levels of government, how do we make sure that we're disinvesting in a way that lets us also build back once the funding or support comes back? And then how do we make sure that we're working towards that support? And so I've found that that's really the question that I'm passionate about trying to get to the root of, because I think the vision of what public health looks like in 20 years is really important, because that's what we're going to leave to the next generation.
I love that so much because it reminds me of a colleague who says she corrected me in conversation. I was like, well, we have to rebuild the public health, system, right? It's been dismantled. We have to rebuild. And she said, well, you know what? She thinks of it as we get to rebuild.
Yes.
And I
Yes.
like that so much because as you were describing that, it's that same energy. Like, yes, this thing has happened and this is where we are, but we get to do that. So this is a time for innovation, for ideas, for collaboration. And I think you're wrestling with the right question right now. I like that.
Oh, thank you. And I mean, it's so interesting because, in emergency preparedness and response, I think one of the things that I've really learned after working countless big and small crises is there's always an opportunity in a crisis. And as awful as the crisis is, and as much as we want to prevent that crisis, and we do our best to try and prevent it, there's always lessons learned. There's, partnerships that can be built. There's a new way of doing something. There's a new, a model or emerging technology that we can use. And so I really like that kind of perspective of, trying to approach this as like a broader system level crisis, but that it's not all doom and gloom. There's reason for hope and there's reason to, build back stronger.
Yeah, absolutely. Let's talk a little bit about your current role. Tell me a little bit more about what you currently are doing and any programs or services that you're responsible for.
Yeah, absolutely. So what is public health emergency preparedness and response? I feel like a lot of people are surprised that it's a job that exists, but normally once they learn about it, they're like, oh, well, I'm glad someone's doing it. So I am essentially responsible for preparing for the worst day that a community might face. And in our instance, that's, the residents of Snohomish County. So we're just north of Seattle, Washington. So I serve about 860,000 residents. So my team and I plan for all the worst things that could happen to the residents in our jurisdiction. And then if and when that thing happens, we lead the health and medical components of that response for the residents in our jurisdiction. So I think it all kind of comes down to cause right, that's like a broad, how do you actually do that? What does that look like? So I think it really comes down to three main things. So the first is we plan, right? I have, staff on my team who their entire job is to write plans and procedures that basically say, if we see an infectious disease outbreak, a white powder incident, or an earthquake, what's public health's role in that, and how do we respond to that effectively and quickly? And they develop all the processes around that. And then I have other staff who take those plans and those procedures, and their sole job is to focus on training staff and the partners that we have to work with. So the second piece of what we do is we train and exercise those plans and procedures that we develop. And the whole goal of that is basically so staff and our response partners aren't picking up and reading this plan for the first time in the middle of an earthquake, because that never goes well. We learned from COVID that people can't read those plans. Sometimes they're, 60 pages, right? You don't have time. So that's the second part. And then the third part is we actually respond. So when the emergency happens, we basically take those plans that we developed, we take the staff who we trained and the response partners that we trained, and then we basically project manage the response so that all the health and medical components happen. So we could be connecting people with vaccines during a communicable disease outbreak. We could be making sure that people have access to timely public health information if there's, an environmental threat at hand. Or we could be, passing out medications that people need to protect themselves or, after an exposure. So that's really the core of it is we plan, prepare, and then respond. And I think one of the things that probably gets missed the most, even by really seasoned preparedness managers and directors, is all of those things, which are grant required. The CDC maps out what we have to do in order to be prepared. So it's pretty prescriptive, but none of that can happen without relationships. You have to have taken the time to talk to, hospital partners, to dialysis facilities, to sheriffs, to fire and EMS partners, and they need to know who you are and, probably have your phone number in order for that response to go well. And so I think that's one of the things that I've really spent a lot of time trying to do, and my staff are incredible at doing, is, really taking that time and space to get to know everyone internal to our department and external who we have to work with.
I love that so much. And I think that's a very critical gap, either missed, overlooked, regardless of not just specific to emergency preparedness, but I see it popcorn around public health. Not trying to beat any of us up, but it's just, I think sometimes it's our head down doing the work and really wanting to put the solution out there, but we forget about that human element. It really needs to start with that connection, and you co-create and build together, which is a bit of a soapbox for me because that's what that's what I do as a consultant. And I work with large organizations, and I'm constantly reminding and repeating that and demonstrating that. But that's so important, and I love hearing that coming from you. So that is, yeah, that's really refreshing also. And keep that in a part of as we rebuild public health, that part needs to become almost like the second nature piece that gets, as it gets integrated in. That's how we need to be doing it without even thinking twice about it.
Yes. And I think that's what's going to let us do some really cool things. Like, I think breaking down some of the silos between sectors is done by that relationship building. And I think that that's where I get really excited about, oh, what's in the future for us in public health?
Exactly. Oh, yeah, I'm on the same page with you on that. That's phenomenal. I've gotta be mindful of time because I could, end on a point and go on and on and on, but I wanna be mindful of time. So I have a couple more questions for you. I don't know how much you can say or not say, so I'm just gonna ask the question and you kind of adjust. But what are some of the challenges that you face in this role, and how are you addressing them? It could be you in your specific role or maybe your department, but what are some of the challenges that you're facing, and how are you addressing those?
I love it. It's a great question. It's a hard question, but a good question. Some of the biggest challenges. If you had asked me that question a year ago, I think my answer probably would have been concurrent threats. So we live in a growing, expanding, evolving world, and we're seeing emergencies increase in cadence and severity. And really good example is earlier this year in Snohomish, we had to respond to a white powder incident tied to a local election while managing a measles outbreak. So kind of responding to two emergencies or two fronts at once. So I think that historically was really difficult, right? Because you might not have enough staff, enough resources, you get burnt out, people are exhausted, there's funding reimbursement issues there. But I think coming out of the COVID pandemic, we honestly got a lot better at that. And at least in Washington, we developed some really incredible relationships with our neighboring jurisdictions and the State Department of Health. And so I think that really bolstered our ability to respond to concurrent threats. So I think after everything that we've been through in this past year, what I would say is the biggest challenge and the biggest threat is funding instability. I think it's not a surprise to anyone that, public health funding really does swing like a pendulum, right? Like we've seen it tied to political movements, to crises, to economic health at large. But in the emergency preparedness and response space, we've gotten really lucky, honestly. And it feels weird to say that. And it's not lost on me that many other parts of public health have not been so lucky in the past year. But we have had really strong bipartisan support for the funding that, is allocated to states and territories to do public health emergency preparedness and response work. And that funding really dates back to the 2001 anthrax attacks. That was kind of the inflection point that led to the Centers for Disease Control and Response distributing that funding across the country. And since that time, we have had really strong bipartisan support in Congress to continue that funding, which is amazing, and it warms my heart and necessary for a lot of reasons, right? That funding has largely remained flat. And so, especially right now, as we're seeing operating costs increase and, inflation, like that's real, right? We all feel that every day. And so do public health departments. And we used to get around that by basically braiding in other funding models or funding streams. And that's how we made that money go further. But in the past year, while our federal funding hasn't been hit by reductions or cuts, typically the different funding sources that we braided in to make ends meet and to help us grow and prepare for the ever growing list of emergencies that our communities might face, that funding has really faltered, and it's started to impact our programs and our staffing levels. So how am I addressing that? A lot of ways, I guess. I think it's an all hands on deck moment right now for public health, trying to be really creative about how do we do this work moving forward. So looking at, shared service models, mutual aid agreements, adopting new and emerging technologies that might help us, work more efficiently. But if I've learned anything, it's that efficiency is only one piece of the equation, and you can only, make something so efficient to a certain extent. At some point, you need sustained and increased investments. There's no way around that. So to work on that piece of it, I've really been pulled a lot more into public health advocacy work, and that might be internal or external to my department. And so spending a lot of time over the past, 8 to 12 months meeting with people and helping them understand the work that we do and what happens if we're not in our roles in a year's time because of the loss of funding. What does that mean for our community members and for the constituents and a lot of our, elected officials, both in, Olympia here in Washington, but then also DC at the national level that they really care about.
Yeah, yeah, that's so many good points you've touched on in that. It's so complicated, you know? I think that everything you're mentioning, even when it comes down to, advocating for what's needed, the basis of that is still relationships, as, you touched on before. So I talk about advocacy quite a bit on the podcast. I open that door and I ask my guests to speak about it quite a bit because I think there's no shortage of, I mean, we can all benefit from the different responses and kind of apply and see what fits and what doesn't. I'm also thinking about a few examples like you mentioned the white powders and the election. Can you maybe talk about some of the other emergencies that you are preparing a response for? Because I think yeah, I'm gonna ask you about that, and then I'm gonna share a story with you.
Yes, absolutely. I love that. So, one of the cool things about being an epi that does work in emergency preparedness and response is that we are required to do annual risk assessments where we basically say, based off of historical data or future predictions, what threats are our jurisdictions most likely to experience. And I love taking that data informed approach to how we're preparing for, potential responses. I think it pays dividends is what I've learned. But infectious disease outbreaks, that's always a really big one. That's kind of like bread and butter for public health, right? But then there's a lot of natural disasters or environmental disasters that we're preparing for. And that, it typically depends on the part of the country that you live in, but there's some threats that are really the same across the country. Things like earthquakes, like wildfires, extreme heat, flooding, right? Like those are some of the ones that it probably doesn't matter where you live, you could be impacted by those in some way, shape, or form. And I think a lot of times people forget that there are health and medical components to those. A lot of times we think about, our first responders who play that immediate role of life safety, which is of course critical and, nothing works without them doing that role. But, as people rebuild and you start zooming out and you say, okay, 72 hours, 1 week, a year out, what do people need in order to live safe and healthy lives? Public health plays a big role in that. So we prepare for those. And then the other one that I feel like is very interesting is kind of these big emerging events, as we think about things like the World Cup or even midterm elections later this year. There are a lot of events or incidents that have the potential for bioterrorism or biosecurity threats. And so starting to prepare a lot more seriously and a lot further in advance for those is something that we've been really focused on in recent years.
I don't know that I would have thought about that as a threat, like these events, but of course, we look at trends and what's happening in the news, it makes absolute sense. Also, I like how you're making like this, like you said, this data-informed approach to like what's being prioritized. I was starting to share this story with you before we started recording the episode. I never would have thought I'm here in South Carolina, southeastern part of the country. I never would have thought that earthquakes or even wildfires was something that I would need to be concerned about. That's a West Coast California thing. But recently, we've had several incidents of wildfires here in the South. I mean, right down the highway from where I live, wildfires, and I'm close to the Georgia border. So, Georgia, Florida, we've had, wildfires. Also, earthquakes. I experienced it. And in fact, anyone who goes to my Instagram account, you will see I actually caught it where I was in a meeting with my team. And during the meeting, one of my team members also lives in this area, and her camera visibly shakes during the time of the earthquake. And then a few seconds later, I felt my house shake. We were just all this nervous laughing energy because we couldn't believe it was happening in real time.
Yeah, you're like, what do we do?
Yeah, yeah. We shared that video I shared that video, and I've gotten so many comments from people in this area who've talked about the history of earthquakes. And I'm thinking, I was like, "Oh, yeah, we're on a fault line." Like, all this stuff I don't know because I've never gone down a rabbit trail of earthquakes because, that didn't happen to me. That's was my thought. So now it brings me into wondering about, like, of course, emergency preparedness. Every time I think about it in my area, it's hurricanes or tornadoes or floods or, like you said, extreme heat, the things that are kind of the obvious here, but not so much earthquakes or wildfires. So I am putting it out there. I am really interested in speaking to someone who has that expertise for the East Coast, especially covering South Carolina. I would love for them to be a guest on this episode, on this podcast, so that I have questions.
People who need to get prepared for this. Absolutely. It's not just a West Coast risk. I love that.
Yeah, we'll see. That's to be continued. So maybe you think about that as you go to these conferences and meetings and you start talking to people. You keep an eye out for me.
Yes, I will find you an East Coast subject matter expert. I mean, but really high level, what I can say from all the work we've done in Washington, and obviously they are different seismic risks, of course, East Coast, West Coast, depending on those fault lines and that geologic activity in the area. But the big thing that we focus on, and we have a very high risk here, it's actually kind of a terrifying situation that I will not even get into, but it's basically called a Cascadia subduction zone. If you ever want to go down a rabbit trail, that's an interesting one of what that will look like. When I moved here, I was shocked to learn about this risk that's pretty high of something that we'll face, in potentially the next 50 years. But when we talk about individual level preparedness for, earthquakes, one of the big things that we talk about, because the risk for such a large earthquake is so high out here, is individual preparedness and having yourself and your household prepared for 14 days, essentially. So that's the time that we think it would take first responders and services to reach community. So being able to sustain yourself for 14 days after a disaster is something that we really focus on. And there's a lot of really incredible resources for, like, what does that mean and what should be in, a go kit or an at-home emergency bag for earthquakes, as well as, the procedure of, duck cover holds, really similar to tornado response. Honestly, it's pretty similar for earthquakes, but there's some great national resources. Ready.gov is one of my favorites. They have things in tons of languages. They've got infographics, and I think that's a really good way that people can get prepared and learn about the risks in their area.
Thank you for sharing those resources. I will definitely explore some of those from us, see what exists, for my area, because there could be stuff out there that I just don't know about. But I still want that person. I want to have a conversation. So I'm open to that whenever everyone listening, be on the lookout. Between Gabby and everyone listening, then we'll find someone for me
Yes,
to
come
bring on.
find us. Come find us.
Well, I've really enjoyed this conversation, and I appreciate you taking time and coming on the podcast and chatting with me. We're going to be able to, I'm going to tell everyone how to get to connect with you in the show notes and all that in just a moment. But as we wrap up, I'm going to ask just one final question. We have a variety of people who listen to the podcast, public health professionals, students, entrepreneurs even. What is one bit of advice that you could give to someone listening to this conversation that would maybe encourage them during these challenging times in public health?
Ooh, I love that. One piece of advice. I think I'd say don't wait until you feel ready to start something, whether that's applying for a job or taking on a project or anything. Don't wait until you feel ready. I think as I look back on my career so far, I don't know if I've ever felt 100% ready for any of the roles that I stepped into or, boards or committees that I joined. And I think that's where like the real growth and adventure of your professional career lives is in that uncomfortability. So say yes to opportunities, just jump in. And then once you get there, just focus on doing great work, make connections with the people around you, trust the skills that you've built in your life, whether that's through, any credentials you might have earned or through your lived experience. You have so much to offer this field and we want all of that experience. So, trust those skills and experiences and build relationships with the people around you. And I think if you can say yes, if you can do great work, if you can build good relationships, I really don't think there's anything you can't do in the public health field.
That's wonderful advice. Thank you for sharing that. I think it's especially relevant in this time as we, are rebuilding. Like I said, we get to rebuild public health, and that's great advice. I think that's especially relevant to what we've been talking about. So thank you, Gabby. This has been great. We're going to definitely keep in touch.
Yes, please. Thank you so much for having me, Dr. Huntley.
If you are a member of the PHEC podcast community, then log in and head straight to the episode activation lab. That's where the exclusive follow-up conversation with Gabby is waiting for you. Now, I hope you really enjoyed that conversation as much as we did. This conversation is a reminder that preparedness isn't just about plans and protocols. It's built through relationships, trust, showing up long before a crisis happens. My guest's story also shows how funding uncertainty and shifting political landscapes can threaten the systems that communities depend upon and why advocacy has become part of the job. And maybe most of all, it's a reminder that growth often happens in the moments we feel least ready. I really hope this episode encourages you to say yes to what's in front of you and trust the experience you already carry. I encourage you to connect with Gabby and learn more about the work that she's doing. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 469, can be found at phecpodcast.com. Once you're there, just navigate to episode 469 to find its show notes. One more thing before we go. After we stopped recording, I asked Gabby one more question. The answer is waiting for you inside the PHEC podcast community in our episode activation lab. You'll find it in a post titled After the Mic. In case you didn't know, our podcast has an app and a private community that is independent of social media platforms, where we engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download our PHEC podcast community app in our mobile app store and is available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.